Hey guys, welcome back to my channel. So today I am here with a little bit of a Harper story for you guys. And we have had a really rough weekend, really rough. So I will go back and tell you exactly what has been happening the last, I guess, 6 weeks or so, which I finally kind of realized this weekend, oh my goodness, this is what has been going on. So I'm thinking about 6 weeks or so ago, I started noticing that Harper would go to the toy box that we have. We have a couple of toy boxes around the house. And if for you that don't know who Harper is my Cavalier King Charles Spaniel. So she would go to the toy box, and the toy boxes are out all the time. They're filled with toys. And every now and then I would see her go to the toy box and she would start taking a toy out, frantically trying to find a toy. And then she would get the toy that she wanted and she would start biting it and licking it and just kind of frantically. And we would try and get her away from it, but she was so fixated on the toy. And I thought that was really weird. And then I would, put her up on my bed so that she couldn't, get to the toy anymore, because I knew that was really abnormal. But I would put her up on my bed, and then she would make this strange noise, in her throat, kind of breathing a little funny, anxious, and I'm like, what is going on? But then after about 10 minutes, it would pass. So I figured maybe she got something caught in her throat. She was trying to get it out. She was trying to cough it up, just trying to think of what was going on, because then she would be perfectly normal. So over the past 6 weeks, she's had a few episodes like this. And the whole time I kept trying to figure out, what did she do before? Okay, well, she ate before, this time. Maybe it's something with the raw food, maybe it's too cold for her, or I was just trying to figure out what is going on. So this Friday, I came home from the studio and I had some work being done outside, and I came inside. I let her out of her playpen, her and Stassi, because Stassi was here that day. I let them out of their playpens and I went outside to talk to the workers that were at my house. And I came back inside and Harper was frantically licking and chewing on a toy, and she had a little bit of vomit right next to where she was lying, and it had some strings in it. So I was like, oh no. So then I thought, well, yeah, this is what's happening. She's getting something caught in her throat. She's trying to swallow it, and she threw up, and this is the remnant. So I put her back in the playpen, and I left to go back to the studio, and I texted my son and said, when you get home, pick up every single toy in the house, because I want to go through them and making sure everything is intact and nothing has holes in it, nothing has loose strings or anything like that. So I texted him that, and I also said, and make sure you feed her because she wouldn't eat this morning. So he calls me when he gets home from school and he said, well, I picked up the toys, and he said that he tried to feed her and that she ate it, but then she immediately just threw up everything that she had eaten, and that she was panting. So I finished up the session at the studio and I came home because I made her an emergency vet visit. My vet is wonderful, guys. I mean, wonderful. I was like, I'm coming over and, she needs to be seen. Something is going on. So, and this is a long story, I'm sorry, but I feel like I need to tell you guys because it may be something that you might run into. So we get to the vet and we do all sorts of testing. We do blood work, we do x-rays, and we also do a barium x-ray where they do the x-ray first, see what it looks like, then they give her some barium, which is like a chalky material, and they see how that goes down. Now, the thing about what was going on with her, she was panting very, very, very hard. She was also swallowing really hard, and she was coughing. So she would swallow, cough, pant, 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 swallow, cough. Then she would want to lick, anything, her fur, her hair, anything, a toy, anything she could, get her mouth on, she wanted to lick. She was extremely anxious. So we knew something serious was going on. We just couldn't figure out what it was. Well, on the x-ray, it did show some sort of material, mass. They didn't think it was like a tumor or anything, but it showed something in her stomach. Now, the vet said, you know what, that could be food, because food can linger on in the stomach, and we really can't tell on an x-ray if it's food or if it's something foreign. So he said she's also full of gas. So she's almost going through what they call bloat, except her stomach was not flipped, her intestines were not flipped, but she had an extreme amount of gas in her stomach and in her intestines. And that was from all that panting, because she was swallowing air. So he said he thought that she was just extremely uncomfortable and in extreme pain. So he loaded her up with everything that he could think of, something for nausea, something for pain, anti-inflammatory shot in case like something was irritating her throat. What else did he give her? Reglan, which coats the stomach and helps get the gas out. So he gave her those medications, and then he also just was watching her, and she was really, really anxious, like really bad. So he gave her a tiny bit of a sedative, which I didn't like that. So she got calm, but she got too calm, and it freaked me out a little bit. And I was like, I don't like the way she's acting, because of course she acted like drugged, and I was extremely nervous. So he reversed it, which thank goodness they have the drugs to do that. So he reversed that, and she did okay. And he wanted to see us back the next morning for an x-ray, like at 7:30 the next morning. He also called me an hour after I left and said, hey, how is she doing? I said, she's resting fine right now. And he says, okay, if anything changes in the middle of the night, text me. I don't care what time it is. See, I told you, he's awesome. I have an awesome vet. So he said, text me anytime. And that way, if she throws up, or if something changes in the way that she is behaving, I want you to go to the emergency hospital. And I already know, like the one I would go to, which is the best. They have all sorts of specialists over there. And he said, but text me. So I said, okay. So I went to sleep, and then about an hour and a half later, my son comes in with her and says, Mom, take her, because she's panting again. She's trying to lick everything. So he puts her in bed with me, and sure enough, she goes to the edge of the bed. She's circling around. She's clearly uncomfortable. She's panting. She's licking the bed. She's licking herself. She's trying to lick Stassi. She's trying to, chew on the edge of the pillow. Like, she's really like freaking out. So I get up and texted the vet and headed on over to the emergency hospital. We get there, and all of her vitals are stable. So she's stable. It's not a definite emergent situation as far as, she wasn't turning blue or anything, but something was definitely wrong. So they redid x-rays, and they also saw this, whatever my vet saw in her tummy. And so they were, concerned. So we left her there overnight, and the doctor, the critical care doctor, called me in the morning. They redid x-rays in the morning. It was still there. So then they were really suspicious that it wasn't food. So he said he was going to repeat the x-rays at about 2 p.m. and if it still showed the same thing, because at that point, if it was food, it would have moved out of the stomach. So he says at that point, we really need to go in and see what it is. So sure enough, it was still there. And so the surgeons called me, and we had a long conversation of all of her symptoms, what was going on. And he told me all of the risk involved, which is scary as hell, you guys, scary as hell, abdominal surgery. And he also said that he could go in there and it could be absolutely nothing, but that he felt that, it needed to be done because they really did feel like it was a foreign material in her stomach. Now, most of the time when you get a blockage, it's in the intestines. which is very dangerous. But you don't really get it too much in the stomach, which was really weird. So she went into surgery, and I was freaking out the whole time. And the surgeon called me after the surgery, and it was the remnants of toy stuffing, hair. She said it was like a giant mass of stuffing and hair, and just like a big hairball. But it wasn't all hair, it was toy. It was evidently she must have gotten the stuffing of a toy, and she said that it had been in there for a while because it had actually adhered to the lining of her stomach. And she had to cut it away from the lining of her stomach, and it all came off in one piece, she says, but it ulcerated, so her stomach is all ulcerated from, having that shaved off of the lining of her stomach. My poor baby. So, but that she did really well with the surgery, that she did well with anesthesia, she is recovering, and that we could come and see her, and whenever we wanted, and that they would update me every day. And so we went today to see her, and she is still doing fine. She's not eating. She doesn't want food at all, which they say is expected at this point. She's getting IV fluids, and so she's getting, some nourishment or fluids that way. And she looked pretty pitiful. She looked, she's on some pain medicine, so she was a little bit out of it. She did kind of pee on herself while we were there, just a little bit. I don't know really what that's about, maybe because she had some pain medicine and she was just everything was relaxed, including her bladder. So that's what we're thinking. But I'm gonna insert a clip to our visit today. So here is Miss Harper here. We are visiting her at our emergency specialist hospital, and she's a little sleepy. She is on pain medicine, and they put us in this room, which is the comfort care room, and we can visit her. As you can see, she has a little IV. Yeah, poor baby. But she's doing fine. She's stable. She is not wanting to eat. So they brought us in this food, which looks very yucky to me as well. And they want her to eat this because it is a bland food, and this is what she does. She's turning her nose up. She's like, no, I don't think so. They did say that this was common for abdominal surgery, that, it maybe take her a couple of days, but she is on IV fluids. So I just wanted to give you a little peek. They have her tail wrapped up in the back because they don't want any bacteria. If she would poop, they don't want bacteria getting anywhere near her incision. So it's baby, sweet baby. She is the sweetest. Everyone is loving on her here because of course she's a sweetheart. So that was our visit today, and we're gonna go back and see her every day while she is in the hospital. I am leaving for Disney in a couple of days though, so I have decided to leave her at this emergency hospital. Well, it's not just emergency hospital, it is a specialist hospital. They do all sorts of specialty surgeries there. They have every single veterinary specialist available there. They have a cardiologist, they have a neurologist, they have, a gastroenterologist, they have every type of vet there. They monitor them 24/7. She will never be alone. She will always have someone right there by her little enclosure that she is in. So I just feel like that is the best place for her to be while I am gone. My son is going to be here at the house. And I'm not taking Stassi on this trip. So he will be here with Stassi, and he'll be here, and I could have brought her home probably in a couple of days, but it would be right before I left for Disney, and I'm not comfortable with that. I am not comfortable in case something would happen. It would be hard for him to go to this hospital because it's sort of far from where we live. And I just think that she needs to recover. She needs to be monitored. And, you know, I am willing to let her stay there in order for her to, you know, recover while I am gone. So that is what's going on. And can I just say, I am so very happy that I have pet insurance, because so far I am up to $5,500, and that is just, that's just with her surgery and x-rays and blood work and her hospital stays anticipated through tomorrow. So anything after tomorrow will be in addition to that $5,500. I am so glad I have pet insurance. You guys don't know how glad I am. Again, I have done a video on this. If you look it up in the search bar, you can find it on Pet Plan Insurance. It is amazing insurance, the best out there. It is best to get insurance when your dog is still a puppy and before it has any type of pre-existing conditions, because you will pay out the nose if your dog is older and you want to get insurance now. So definitely, if you're getting a new puppy, spend the extra $30 a month for pet insurance, because I promise you, if you need it, you will be so glad that you spent that extra $300 to $500 a year on your pet insurance, because $5,500. And you know, it's not like she had brain surgery or anything. I mean, yeah, she had abdominal surgery, but you know, it's not that serious. Well, it is serious, but you know what I'm saying. Like, they didn't do all that much in order to incur $5,500. So I'm so glad that I have the insurance. So she's going to be on the mend. I have faith that she will be okay. We have picked up all of the toys in this house, and I don't think that I'm putting them back out, like probably ever. I'm gonna look for some indestructible toys. She even got through some of the really, really tough, what I thought was indestructible toys. Now, I don't think that she got, those didn't have stuffing in them, so maybe I will bring those out. You know, I'm gonna inspect everything, but it definitely will not be any ropes, any rope toys, or any plush toys, which I feel bad for Stassi because she loves those. But it's just too dangerous. And unless you're gonna be right there with them while they're playing with the toy, that's fine. But if you're just gonna leave toys out like I did in a toy box, you know, you forget to go and go through the toys and see, you know, what's good and what's not good. So it's probably best that, you know, I just pick up the toys and just have a couple of chews out, and that's it. So that's what I'm gonna do. I urge every one of you to go through your pet toys right now, and if anything has a hole in it or anything looks like a potential food item for your pet, throw it away, because it is not worth, you know, having to go through this, because it's been a bad weekend. So that is it for this video. Thank you so much for joining me, and I will do an update on Harper. Check out our Instagram page, Simply Rocks 2017. I'll probably do maybe a update on Harper there. I don't know if I'll do another video, but I'll probably do an update there, and maybe on our Stassi the Zoo Facebook page. So thanks for watching. Have a great weekend. Bye guys.